We just wanted to clear up a little confusion that was out there in the community as reported on some of our responses and strategies to Councillor Walter's question on the 2016-28 operational budget. He asked us what factors are the Edmonton Police Service looking at and how do they mitigate situations with individuals with mental health issues. And our response was a fairly lengthy one. You can look at our response online through council budget information. But essentially, we talked about a number of options. And I think this is important because when the chief asked earlier this year, what can we do to improve efficiencies and effectiveness in the organization, probably in the top 5 responses from throughout the organization was we need to do a better job at dealing with individuals, what we call with Form 10 apprehensions, or people with mental health issues. And that came loud and clear. In the area I work in coordinated policing, we have a projects branch, and we looked at this very closely with our partners and our stakeholders that included Alberta Health Services, Mental Health and Addictions. We involved Covenant Health as well as the RA Hospital and the University of Alberta Hospital to talk about how we could alleviate some of the wait times. So we did a study early in 2013, I believe it was, and our wait times were very excessive. They probably averaged in between 2, 3, and 4 hours. That includes wait times for people with mental health issues, but also wait times with people with medical issues that we have to go to the hospital with, and or people that are in our cells that have to go to the hospital. And these strategies with our partners and stakeholders took on a different perspective, and we began to look at the issue from a collective standpoint. What is in it for the emergency departments, what's in it for Alberta Health and Addictions, and what's in it for the Edmonton Police Service? So we looked at solutions in that regard. One of the ones that we talked about early in the discussion with our stakeholders was what other locations can we go to? With the way the Mental Health Act is, we can only take individuals to 4 sites in the Edmonton area. That's the 4 hospitals plus Alberta Health, Edmonton Alberta Hospital out there, and that's the 5th location. But we don't take individuals to that hospital. We take them to the 4 general sites, and you can imagine travel from around the city with officers to do that. And when we looked at these other options, we explored the new Remand Center, which has medical facilities there, has doctors, has nurses, and we looked at that as just a thought, just kind of spitballing ideas, what could work. We also looked at an idea of thinking about the Alberta Hospital, as I mentioned, but the travel was too late. And that was quickly dismissed as not being too feasible. And we went on to other initiatives. One initiative is we're looking at diversion. We're looking at moving people away from going to the hospital with Form 10s and getting them into community supports and stabilization in that regard. And we've seen some good success. Over the last 2 weeks, the Alberta government asked us to look at our Form 10 apprehensions and where that was taking us and what we were doing with that. And we looked at a number of these options, and I think we're having some good success. Our wait time is beginning to trend down, and we're beginning to see some better outcomes for our clients as well. We also are very strong, as you know, on the heavy use of service and that model that we have about dealing with people with mental health and addictions and how we're moving them forward and getting them housed and getting them the supports and the connection. Because in the end, it's not just about what we're trying to do as services and systems, it's what service we're able to provide our clients and make their lives better as well.